This was a really great exercise that got people from thinking about general, vague challenges and sort of not really understanding how to do a five whys root cause analysis and they're having very vague interventions to a process where people were really excited about trying to figure out how better to dig under and under using the five why approach, and also then to think about the actions that come out of the root cause that they, at their level, within their job role, could actually address. Mary Gloria Orji, who said it really well, she said, my 3 peer reviews were just wonderful. They threw ideas to me I hadn't thought about. And I will now try to reach the influencers and do whatever I can to work with them. After we did that exercise of practicing, getting more specific on the challenges and the 5 whys, we went to the peer review exercise, and that to me was probably the most powerful. Basically because when you look at what others have done, you also self-reflect and you realize, oh, this person did this kind of thing, and I love how they did their 5 whys, and I've learned some tools and techniques that my peers are using that I can now apply to my own. So I haven't read the final submissions because those came in yesterday, but I'm really excited to look at those and to understand what is the difference between those first drafts and the final drafts of the root cause analysis. Because I do think if we don't really understand and address root causes in the local context, our actions and our implementation is going to be, as many participants said, just surface. We're not really getting underneath to address some of the really big issues underlying it. That is possible within the realm of my job description. People are joining and they don't know anybody else, or maybe they see a few familiar faces, but there's this wide variety of locations and experiences and expertise. You have CSOs, you have a lot of government people, people from all levels of the system. And in these sessions, location doesn't exist, doesn't impede you. The hierarchy of where you are in the system doesn't really matter. Everybody is sort of on that equal platform of having an equal voice. And being able to learn about someone in Sokoto, learning about what's happening in Anambra. It may be that it's very different local context, but to understand that they have the same challenges and that they're figuring out how to address those challenges in some similar ways, but also different ways, that was very, very powerful. But also to be able to see health workers being able to talk on the same level, with state level, with national level participants, and just that sort of equality amongst the participants was really great to see. Lots of enthusiasm, lots of motivation of those who joined, especially those who joined on the optional days. But I would say that being able to learn from your peers and understand that you're not alone, that you have many, many others who are going through similar challenges, especially resource challenges. I think that was very, very powerful. That was different in tone than being sort of in a physical room and talking with people who only come from the same area, whether it's an LGA or a state, or if you go to a national event or a training, it's a little bit impersonal. You don't have too many opportunities to connect. Whereas with this event, you had multiple chances through group work, through Telegram channels, through all the different plenaries. So many, many opportunities to get to know each other and to learn from each other.
What for you is the follow-up that is needed from a lot of energy, a lot of enthusiasm to an outcome?
I would say at the formal level with NPHCDA and the state primary healthcare development agencies, it would be really important for them to know what are the ideas and things that are emerging from their states. So, for example, there were many, many states that had participants from all levels of the system that were in high numbers. You see, Kano State had 113 participants. Bauchi State had 101. Niger State, 109. Kaduna, 68. Sokoto, 62. Abuja, the Federal Capital Territory, had 66. So these are examples of where if the State Primary Healthcare Development Agency was aware of some of those ideas and some of the action plans, that could be something for a follow-up to see how can those good ideas and plans connect in with the annual micro-planning process. And I think most states towards the end of the year are doing their 2025 annual planning and micro-planning. And so it's trying to figure out how to connect the dots with all of these motivated groups of people within your state, and how can that connect to what you're planning for next year? How can it connect to if there's newly emerging leaders that are being recognized? How can they help to move things forward in their LGA or their whether it's a ward LGA facility? Finding out those different people who might be able to move things forward is really important for state level officials. I would say at the UNICEF and other partner level, it's also important to support NPHCDA in making those connections, that you can have good plans. And we've seen many, many times before where there might be good plans, but the challenge is with execution and implementation. For more of the CSOs, local NGOs, one thing is to connect more to the formal channel. So if you're in a state and you are motivated and you saw a lot of things that were happening from your root cause analysis that could be helpful for state level engagement, trying to think about how might I engage with the SERIC, the State Emergency RI Coordinating Committee, if one exists in my state. How can I share those ideas even at the LGA level with different LGA health team members? How can I make sure me as an organization, I'm implementing something that's of good quality and feasible to do? And then at the individual level, it goes back to that point of you've come this far, you've done the root cause analysis, you've come up with these practical action points, but it's of no use unless you actually implement and you do a good job at implementing. So for the individuals, the call is those 413 people who submitted a draft root cause analysis. When you've gone through the peer review process and you've gone through finalizing your root cause analysis plan, what are you now going to do to make sure that you can implement what you proposed? And to me, that's the bottom line, is all of this root cause analysis and action planning is great, but it won't have impact unless we're able to take it forward and follow up with implementing the plans.
Charlotte, you've been listening to Jenny's insights and some quick analysis right after the final assembly of this peer learning exercise that ends formally today. What are your thoughts on the significance of what we did? What would you say stood out for you? What will you take away?
The energy and the enthusiasm of the group, but also exactly what I heard from participants today. First and foremost, they're talking about learning a little bit more about critical thinking, wanting to look beyond the surface and dig deeper to find out why they are facing some of the challenges they are facing, but not only limited to that, but also hearing from them talk about action. That is, some indicated today that they have already begun taking action to solve their challenges. One thing that also stood out for me today was the private-public partnership that kind of like started informally through the interaction of peers in this process. Like Jenny said, it's not about system level, it's not about organizational affiliation or job roles. Everyone is on the same platform. But even at that, people coming with their context, with their organizational hats and backgrounds are able to interact with each other and look for ways in which they can collaborate. So my wish, my desire will be to see this translated at the highest level, at the policy making level of the country. That is more interaction and collaboration between state level, Ministry of Health, immunization officials with the partners that are at that level and the CSOs, and why not federal level collaboration between NPHCDA, NERIC, WHO, UNICEF, building on the frontline experiences that have been shared. And I think we are still in our role as TGLF trying to bridge the gap or facilitate the interaction between those that are in contact with the communities that are there to deliver the vaccines, that are facing the day-to-day challenges, with those that are able to mobilize resources and develop guidelines and policies that should be useful and helpful for frontline health workers. Now, we have over 400 root cause analysis. The next step for us will be to be able to review those and give them back to the producers of this knowledge, that's the frontline health workers, trying to highlight the key themes that are cutting across the different challenges that are being faced, notably zero dose, reaching zero dose are under immunized, vaccine hesitancy, HPV vaccination, responding to outbreaks, you name it. So around those key thematic areas, and also going back to the stakeholders and our guides to see how they can use all of these resources for better immunization outcomes and action in Nigeria.
Yeah, I think if there's a follow-up, it would be really interesting to gather a bit more information on what did you do? How did you help others with what you learned? And to understand some of that follow-up picture. Because I think that's a really critical thing if we're finding that it's motivating and in a group to do this exercise, but then it's hard to actually implement and plans aren't being followed up. It's sort of half of that picture. So what are the things that we're able to find out from what's next? To me, that's a critical piece.
So for me, it's going to be a question or two questions. Now that you have done your root cause analysis, now that you have written down 3 actions that you want to take to solve your challenge, what next? So what are you going to do with that? When we come back, if we come back to you in 3 months, in 6 months, what would have changed? The answer to that question is going to be of much interest to us. That is the whole essence of the exercise.